Discouraging news suggesting our nation's opioid epidemic is actually getting worse. This afternoon, the CDC announced opioid overdoses have risen dramatically over the past year.
That's actually based on data from our nation's emergency rooms. Our own ER Dr. Frank McGeorge is here with a closer look at that part of the fight. Frank.
Well, Devin and Kimberly, nationwide, the CDC reports a 30% increase in ER visits for opioid overdoses from July of 2016 to last September. Now, in the Midwest alone, there was a 70% increase. That doesn't include Michigan because our state numbers weren't available to the researchers. But it suggests we are losing the battle against opioids on many fronts. It's an epidemic that's not discriminating. The increase in overdoses were seen in adults of all age groups, in men and women, and in every region of the country.
It can happen to any one of us, any one of our family and friends. It has no boundaries.
The CDC laid out a multi-point plan highlighting what the federal government, local health departments, doctors, and the public can do to help fight back. One of the places the CDC sees room for improvement is here in the emergency room. While saving lives of overdose patients is obviously the top priority, health officials say more needs to be done in the emergency room to address the longer-term needs of addicts. That includes improving the handoff system where ER staff connect patients with case managers or peer navigators to link them to treatment for follow-up services. The CDC says there also needs to be an increase in Narcan distribution to first responders and addicts' family and friends. Local health officials agree.
We have folks that are dying, overdosing because of prescription drug abuse as well as heroin drug abuse. So we feel that it's our responsibility. We're the safety net to provide this service and these kits to all the families, all the residents of Wayne County.
So on a conference call this afternoon, the acting director of the CDC said this is a complex, fast-moving epidemic that is just getting worse. And the takeaway message is it's going to take a village to stop this. There is just no one simple solution.
You'd like to feel like we show a little improvement after the intense focus that's been on it for the last 2 years or so, but nothing yet then.
Well, not based on these statistics, but there is gradually some movement, but clearly we need to do so much more.
Yep. Indeed.